Gestational diabetes, what are the symptoms and who's at risk of developing it? Hi, my name's Sade Dansil. I'm a dual qualified nurse and midwife here in the UK, giving you all the tips you need to have the best possible birth outcome. Gestational diabetes is a type of diabetes that develops during pregnancy and usually resolves after delivery. It occurs when the body doesn't produce enough insulin to meet the needs of the pregnancy, which results in high blood sugar levels in the body. Symptoms can include increased thirst, frequent urination, dry mouth, increased fatigue, blurred vision, and itching down below. It usually develops between 24 and 28 weeks of pregnancy. And if you are at risk of developing GDM, your healthcare provider will offer you a test to check whether you have developed GDM. This is usually offered around 28 weeks of pregnancy. And if you are found to have developed GDM during your pregnancy, there are many ways which it can be managed, including diet control, where you control your blood sugar levels through your diet and eating and exercise, through oral medication like metformin, or through injections into the belly, which help regulate your insulin levels. If this is the case, your healthcare provider will talk you through all of the necessary steps to keep you and baby fit and well. Who's at a higher risk of developing GDM? Mothers with pre-existing conditions such as polycystic ovaries, not being physically active or living a sedentary lifestyle, having a family history of diabetes, or having GDM in a previous pregnancy. Potential risks include an increased risk of developing high blood pressure or preeclampsia, a slightly increased risk of developing by cesarean section, and an increased risk of developing type 2 diabetes later on in life. Some key milestones to note if you have developed gestational diabetes is that your healthcare provider will most likely offer you an induction of labor, meaning they will want to start the labor earlier to reduce risk of complications in labor. I hope this video was helpful. Let me know if there's any other topics you'd like me to cover.